Amy Luedemann, and I'm at Kidstown Dental, and I'm making this video for our patients who are 3 or 4 years of age and older, really pretty much any patient, although we have a lot of information for infants and young babies. But this is for older children and adults who have a frenectomy procedure in our office with a laser. So in this video I wanted to discuss a little bit about the aftercare and what to expect, because that's something that comes up a lot. A lot of parents or patients want to know how uncomfortable will they be afterwards, what is the pain level, and what's expected afterwards to get a good result. So first of all, if you've had the procedure already, you will have had to have some preoperative work, which is really important to get the tongue ready for the procedure and ready for the best possible outcome. And so you've done that, and you're going to have the procedure. So the day of the procedure, we'll be asking you to do some things during the frenectomy to assure that we get what's called a functional release. So you'll actually be doing some of the exercises during the surgery. You'll be completely numb and should not have any pain during the surgery. As far as after the surgery, sometimes we place stitches, but generally, because we use a water laser or a CO2 laser, those are non-heat laser applications, and there really is very little contraction afterwards and not a need to do stitches. But sometimes we will do that anyway if we're concerned about the patient's ability to do aftercare work and if it's suitable in that patient and that particular surgery site. So once you leave the office, you'll be numb for a little while. The next period of time, what we've generally found with patients that can communicate with us is that when they talk and when they eat and just do their ordinary daily activities, they really don't have any pain. It's just when they're doing the exercises and aftercare that it's uncomfortable. So for example, one of the things you'll have to do is a tongue suction hold, which looks like this. And when you're doing that after the surgery, there will be a little ulceration or a wound underneath the tongue, and it's kind of uncomfortable. But I will say that in all the time that myself or my associates have been practicing and doing thousands of frenectomies, we've never had to write a prescription for narcotics. We do give a homeopathy that we mix here in the office, which is for anti-inflammatory purposes, and it helps quite a bit. But some patients do choose to take Tylenol or Motrin, and they say that that helps them a little bit. You can also use some like 20 drops of fractionated coconut oil to 1 drop of clove to numb the area ahead of time. You can use ice for younger kids. You can use breast milk chips or popsicles or frozen fruit to numb the area so it's more comfortable when you do the stretches. But all in all, we would say that most people say the only time it's uncomfortable is when they're actually doing the stretches and the exercises, and otherwise they're completely comfortable and don't have any pain. For those that do have any pain or soreness, Tylenol or Motrin is more than enough for them. So hopefully this takes away a little bit of the fear of the afterwards, after the surgery. It's a super simple surgery, but has a huge positive impact on the life and the quality of life of the patient. If you have any more questions or concerns, please feel free to contact our office, and we'd be more than happy to go over your questions and concerns with you. And thank you so much for watching.